In this video, we'll talk about osteoclastoma using the Shrek and Fiona mnemonic. Before we go further, I'll tell you a short story. So, if you have seen this film, you might be knowing the female lead Fiona will be cursed with something, and then the male lead Shrek will bring her some cure, and then they both fell in love, they make kids, and all. They live happily ever after. So, something like that, I have narrated a story. So if you see here, the female lead Fiona will be cursed with some terrible knee pain. And this Shrek is a giant monster. You can see in the picture, he's a giant monster. And he's a very angry guy. He's very aggressive. He destroys everything. Totally, he's a bad guy, right? But though he's a bad guy, he will be having this soft corner for Fiona. They both fell in love and they play with the soap bubbles and all. They in the second picture, you can see they are making the soap bubbles. And the third picture, you can see the scrambled eggs, right? So the Fiona, with love, she cooks him scrambled eggs every morning. And one day they decided to get married and have kids. So they'll name them this mononuclear cell and the osteoclast giant cell. So let us read the description here. So giant cell tumor is a locally aggressive tumor because we have seen our giant monster, our hero, is a locally aggressive guy. Everyone is scared of him. He's destroying everything, right? So giant cell tumor is a locally aggressive tumor. And knee pain is seen in women of 20 to 40 years of age. So the female lead here is cursed with this knee pain and she is in the age of 20 to 40 years. And it's a benign tumor because though this guy is a locally aggressive guy and everyone is scared of him, though he's a bad guy, he will be having the soft corner for the female, right? So it is a benign tumor, not a malignant tumor. And so purple appearance, you can see it on radiological finding. So while they are in love, they are making the soap bubbles, they are playing with it and all, right? So correlate the second picture with the soap bubble appearance, which you can find in radiology. Coming to eggshell appearance, she is making him scrambled eggs every morning. So remember that scrambled eggs with this eggshell appearance, which you can see in the gross finding. And mononuclear cell and the osteoclast giant cell, which you see microscopically, are the children of the Shrek and Fiona. So this was a lovely story. Now let us read about the story of osteoclastoma. So coming to the definition, it is a locally aggressive, benign neoplasm of mononuclear cells. So here the neoplastic cells are mononuclear cells. Occurrence seen in mostly women of 20 to 40 years of age. Just like we said in our story, Fiona is a woman who is cursed with this terrible knee pain and she is aged between 20 to 40 years of age, right? Coming to the pathogenesis, here the neoplastic cells are mononuclear cells. So here the mononuclear cells will be expressing this rank ligand, right? So this rank ligand will cause proliferation of osteoclast precursors. What happens if this osteoclast precursors are proliferating? It will eventually turn into this mature osteoclast. So whenever you see this word osteoclast, remember the C in the osteoclast will stand for cutting the bone. Whereas in the case of osteoblast, the B in the osteoblast will be standing for building the bone. So the mononuclear cells are the neoplastic cells which show this mitotic activity. Because these are neoplastic cells, it will be having this high mitotic rate, right? They divide fastly and all. So this mononuclear cells will be showing this mitotic activity. Coming to the site, knees are involved, distal femur, proximal tibia is involved, you can see in the picture beside, and epiphysis of the long bone. This tumor will be occurring in the epiphysis of the long bone. Coming to the clinical features, there is more osteoclastic activity. What happens if there is osteoclastic activity? It will cut the bone and cause fractures, arthritis, knee pain. So you can see this clinical symptoms. Even in our story, the female lead is cursed with this terrible knee pain. Coming to the treatment, what will we do for this osteoclastoma? We'll surgically remove the tumor. And observation is needed. Though it is a benign tumor, it has a high chance of turning into this malignant tumor. So we have to observe it properly. So because the giant cell tumors are potentially malignant neoplasms, we have to observe it after the surgical removal of this tumor. Coming to the morphology, on gross morphology, before we read the text, let us just see the picture. So in the first picture, you can see it is occurring in the epiphysis of this long bone and you can see a well circumscribed lesion and it is somewhat in brown color, right? And if we go to the second picture now, you can see this reddish change or reddish discoloration and all, and you can see this brownish black color which are like necrosis and all, right? And you can see this fleshy hemorrhagic conditions and all. So now let us read the text. So it is arising from the epiphysis of the long bone. You can see a well circumscribed, reddish brownish colored, hemorrhagic, fleshy tumor with cystic degeneration and necrosis is also observed. And coming to the eggshell appearance, what do you mean by eggshell appearance? So what happens here? This tumor is growing in the epiphysis of the long bone, right? So what happens? As it is a locally aggressive tumor, it grows and grows and it expands into the cortex. So once it is expanding into the cortex, when you touch the skin overlying it, it will produce this egg crackling sound. So that is why it is known as eggshell appearance. So these lytic lesions expand into the cortex. On palpating, it produces this crackling egg sound. Now let us see the microscopic findings. As we have said, our two kids, not our two kids, like the kids of Shrek and Fiona, their names are like mononuclear cells and osteoclast gene cells, right? So mononuclear cells, these are uniform, oval, large, prominent nuclei, scanty cytoplasm and mitotic activity is very high. Why? Because these are the neoplastic cells. So if you can see in the picture, beside picture, you can see all these neoplastic cells, like these are uniform, these are oval with the scanty cytoplasm but the large nucleus. So these are the mononuclear cells, and all these mononuclear cells will be clustered at one place to form this osteoclast giant cell. Osteoclast contains hundreds of nuclei and are large, so they are named as giant cells. So the two babies of Shrek and Fiona are mononuclear cells and osteoclast giant cells. Apart from this, you can also see this cystic degeneration and necrosis in the microscopic picture. So if we summarize this microscopic picture, we'll see this mononuclear cells which are uniform, scanty cytoplasm, large nuclei, oval shaped cells. Whereas you can also see this osteoclast giant cells where it will be having hundreds of nuclei, and these are so large, that is why it is called as giant cell. And cystic degeneration, necrosis can also be seen. So these are expansive lesions. They expand slowly. So these are also called as lytic lesions because they grow slowly and they expand slowly. So it destroys the cortex. So in the previous slide we have talked about this eggshell appearance, right? So this is growing from the epiphysis of the long bone into the cortex, producing this egg crackling sound. So that is what is said here. Coming to the radiological findings, you will see this soap bubble appearance here. So in our story, they fell in love and they're making the soap bubbles and scrambled eggs and all, right? So here comes the soap bubble. So soap bubble appearance is seen because the soft tissue masses are surrounded by a thin shell of reactive bone. What is a reactive bone? So this reactive bone is something which is formed because of an activity of neoplastic cells, right? See what I have said before. There is a lesion in epiphysis of the long bone which is growing and it is expanding into the cortex. That new layer which is getting expanded into the cortex is a reactive bone. So there is a formation of thin shell of this reactive bone which is getting expanded into the cortex. So there you can see this soap bubble appearance on radiological finding, right? Yeah, we have come to an end. This is our story. This is about osteoclastoma. Bye. I hope you like my video.